This is the case scenario that we will be considering for this presentation. Fandy is a 14-year-old new immigrant from Turkey who recently moved to the Black Creek neighborhood. She came to the community health center where you work, asking for assistance. She is enrolled in a local high school where other teens laugh at her clothes and her inability to speak English. Yesterday, a classmate grabbed her lunch and threw it in the garbage, saying it smelled. In considering Fandy's situation, we believe that the social determinants of health that are at risk for Fandy are race, social inclusion, freedom from discrimination and violence, gender, and access to health services. Race or racism as a determinant of health. Racism is defined as organized systems within society that cause avoidable and unfair inequalities in power, resources, capacities, and opportunities across racial or ethnic groups. Racism can manifest through beliefs, stereotypes, prejudices, or discrimination. It can be interpersonal or institutional. Looking at Fandy's experience of racism, Fandy is experiencing interpersonal racism as other students made fun of her clothing, food, and inability to speak English. All of these factors are connected to her ethnicity. Racism can have a significant impact on mental health. A person experiencing racism has adverse cognitive, emotional processes and associated psychopathology. We often see an increased incidence in mental health conditions, including depression, anxiety disorders, post-traumatic stress disorder, eating disorders, and psychosis. We often also see a diminished participation in healthy behaviors such as sleep and exercise, and also an increased engagement in unhealthy behaviors, including alcohol and drug misuse. Fandy, having experienced racism, is at risk of having her mental health impacted and experiencing some of these symptoms. Considering the social determinant of health of freedom from discrimination and violence, we want to first look at the definition. Discrimination refers to actions taken to exclude or treat others differently because of their race, ethnicity, gender, sexual orientation, and/or disability, creating a hostile and stressful environment. Violence is often the vehicle through which discrimination is acted out and includes abuse, neglect, bullying, violence with intimate partners, sexual violence, state-sponsored violence, self-directed violence, and collective violence. We believe that Fandy is experiencing racial and ethical discrimination, violence, and bullying from her peers at school. Discrimination can have an impact on mental health. Discrimination is a psychological stressor that can lead to a number of stress-related, emotional, physiologic, and behavioral changes. Somebody who experiences discrimination often experiences the emotion of distress, sadness, and anger. And we also see a decrease in positive behaviors and an increase in harmful behaviors such as alcohol, tobacco, and drug misuse. And Fandy is at risk of developing some or all of these as she has been impacted by discrimination. Considering the social determinants of health of social inclusion and exclusion, we know that social inclusion can have a positive impact on mental health. It can promote feelings of attachment and companionship. It can enhance a person's sense of purpose and self-esteem, and it can enhance a person's ability to deal with adversity. So it is very important for people to have community and be socially included. Social exclusion can be harmful to mental health. It can cause psychological damage and harm health through long-term stress and anxiety. We know that Fandy is experiencing social exclusion within her school environment. She has not yet found that connectedness or that place of belonging with her peers. Fandy's school peers have publicly pointed out and mocked her differences, and she is also facing a language barrier due to her inability to speak English, which also increases her chance of social exclusion. Considering the social determinant of health of gender, we know that Fandy's female gender makes her more likely to experience a negative impact on her mental health. The Canadian Mental Health Association reports that women in Canada experience more adverse social determinants of mental health than men do. And we also know that girls are more likely to be bullied than boys, especially when considering social exclusion and cyberbullying.
Access to healthcare services. Canada has a publicly funded healthcare system coming from taxes. All Canadian residents have reasonable access to medically necessary hospital and physician services without paying out of pocket. The provinces and territories also provide supplemental coverage to certain groups of people, such as the seniors, children, and social assistance recipients. This helps pay for healthcare services that are not generally covered under the publicly funded health care system. These services include vision care, dental care, prescription drugs, ambulance services, and independent living or home care services. Those who do not qualify for supplementary benefits under government plans pay for this service through out of their pockets or private health insurance plans. To access healthcare in Canada, an application for a healthcare card is needed. Present your health card to prove that you are registered. Prepare for the waiting period before you get covered, which may take up to 3 months for your public health insurance to start. There are barriers and challenges to quality healthcare. One could be complex health insurance eligibility and entitlement rules. Example of this would be the eligibility rules and length of time that immigrants must wait for landed status and healthcare when they apply. Another one could be lack of care provider knowledge and skills. It could be lack of knowledge of policies of local hospitals or clinic concerning newcomer eligibility and emergency care, or limited knowledge of local community services that facilitates healthcare access, and lack of knowledge of basic delivering culturally competent care. So when providing culturally competent care, we have to provide better care, which includes some understanding of newcomers' medical concern within their social context, particularly their culture of origin and the challenges of migration. It could also be unfamiliar with problems and illness that are uncommon in Canada, that are more commonly presented in newcomer patients. So, like illnesses that are not seen in Canada, infectious diseases, non infectious diseases, and other mental health problems. Other barriers and challenges to quality healthcare could also include limited access to physicians. This could be due to limited language skills. Another one is limited pre-arrival healthcare. So newcomers may have received inadequate or substandard care, leading to unmanaged complex medical conditions. Limited language and literacy skills like language barriers and lack of familiarity with the Canadian healthcare system. So because they are just new to Canada or to the country, so they are not yet familiar with the healthcare system in the country. So unstable finances would also include barrier and challenges to quality healthcare. So immigrants, they are financially insecure and uncertain about their finances. Another one could be related to culture. So Culture influences dominant views of the causes and management of illnesses. When the care provider and the patient are from different cultures, the respective understanding of illness or treatment may vary significantly. Or it could also be mistrust of government and services, like unpleasant experiences from authorities, especially for children. Newcomer children and youth are more likely to have negative attitude towards authority if they have experienced detention, abuse in torture, psychological deprivation, insecure residence, or separation from parents, guardians, or extended family members. So in the case of Fendi and her family, migration can cause stress which can be traumatic. Migration-related trauma is experienced from very individualized perspective owing to a combination of factors including personality, family, and personal values and cultural norms. So Fendi and her family could be experiencing the above the mentioned barriers and challenges to healthcare since the family is new immigrant in the country. Personally, Fendi could be experiencing limited language and literacy skills for she was unable to express herself due to limited English language. Culture factors like the way Fendi dresses and her food preferences since she's being bullied at her school due to her culture. Because of these challenges and barriers to healthcare, Canada has a resettlement programs, especially structured to support the most vulnerable, often those who are experiencing significant migration-related trauma.
According to Wilkes and Wu, trust is very essential to our very existence as social beings, similar to the role of oxygen for our biological existence. Most immigrant youth experience stigma because they are labeled as outsiders. Most times they are also considered as undocumented. All of this put them at the lowest status of society. An increased instance of being stigmatized leads to a broader concept of discrimination, which in the case of Fandi, being laughed at the way she speaks and her manner of dressing. As a result, immigrant teens might find it challenging to trust others. How to build a trusting relationship. Involving children and young people in discussions about their care. Being honest and open with them and their parents while respecting confidentiality, listening to and respecting their views about their health and respond to their concerns and preferences, explaining things using language and other forms of communication they can understand, considering how nurses use nonverbal communication and the surroundings in which we meet them. Giving opportunities to ask questions and answer this honestly and to the best of our ability. Doing everything to make open and truthful discussion possible, taking into account that this can be helped or hindered by involvement of parents or other people. Giving them the same time and respect that we would give to adult patients. Nursing roles and assessment tools. Nurses as professional health workers can collaborate with schools. Nurses can become educators and advocates for children, teens, parents, and teachers. Nurses can also be counselors and help develop programs to stop bullying in schools. Nurses can also collaborate with teachers and educate how to properly identify signs of bullying. These interventions can be put in place early in time before creating a more serious threat to the person's emotional state. The SHADES or the HEADS assessment tool is a history-taking tool to enhance rapport between the provider and the youth and ensure that the information gathered is relevant and complete. The strength-based approach to screening and counseling adolescents in clinical setting has been proven to help build resilience. Developing resilience helps kids handle failure, which is an important predictor of life success as an adult. Using the SHADES questions allows providers, educators, and caregivers to understand more of what is happening in a teen's life and how to best support them. S stands for strengths. Asking teens what they perceive as unique abilities is a fascinating way to start a discussion with a young person and can be very revealing. S stands for school life. Asking young people what their favorite subject is and if they are having difficulties. H is for home life, asking who they live with or if they get along with them. A is for activities. This can include asking about how the amount of time spent on phones and computer, what time they go to bed. D is for drug and alcohol use. Can also include asking about diet and perception about body image, how teens look at themselves, and what activities they do with their peers. E is for emotions, including depression and suicidal thoughts, and S is for sexual health and safety. The next two slides are other examples of assessment tools. The following are examples of bully-only scales. The following are examples of victim-only scales.
Hi, I'm Kathleen, and I'll be discussing the strategies that we would use with Fandy. Addressing the issue of bullying does not only involve the person bullying or the person who is being bullied. It takes a whole lot of community to address such incidents. First is to create an environment where Fendi feels comfortable in talking or sharing her feelings and safe to talk to, including a healthcare provider or someone in the team who can speak her language would help. Next is to make a commitment to resolve the bullying issue. Next is to discuss the incident with the school personnel and Fandy's parents. Next is to refer Fandy for counseling, and then recommend Fandy to engage in social activities to foster opportunities to build socializing with friends at school. Find out what she likes and connect her to local activities of interest. Refer Fandy for a government-funded language class or an ESL. Follow up with the school to ensure that bullying has been resolved. Resources or external partners might be useful for Fendi. First is a social worker. It can hold who can hold individual and family counseling sessions, help the children and other families to adapt to transition, since transitioning is always the most challenging part of migrating to a new place. The teacher or the school staff, since bullying usually happens in schools and the bullying incident happened in school, coordinating with the teacher and the school staff is necessary. The police, Toronto Police Services or the Royal Canadian Mounted Police, some bullying incidents and cyberbullying may result in consequences of criminal record. The Canadian Red Cross have the Beyond Hurt program that includes online courses, workshops, and trainings that addresses bullying in schools and brings together the key stakeholders in recognizing, preventing bullying and building empathy and respect in the community. Community and charitable organizations and agencies. This can include Access Alliance, which is an organization that services and advocates to improve health outcomes for new immigrants, refugees, and their communities, which have been made vulnerable by the systemic barriers and poverty. Stop the Bully. It's a registered national charity which allows any student in Canada who is a victim or a witness of severe bullying to be able to safely report the details to school officials without risk of becoming the target themselves. The Black Creek Youth Initiative. This is a youth-led organization providing a safe and inclusive space for the youth of Black Creek. This was formed to address challenges encountered by the youth in the community. Conclusion: Fanny has experienced many sudden changes when her family migrated to Canada, including the weather, the cost of living, a language barrier, and a whole new culture. She is experiencing a language barrier, social exclusion, racism, ethnic discrimination, and bullying at school. As her community health nurse, it is most important to build trust with Fandy, to address the bullying issue with the school, and help her build community locally and connect her to local activity and resources while continuing to be a support for her. This approach will support Fandy's emotional and mental health as she adjusts to living in Toronto.